Thanks for joining us today. With us, we have Dr. Adam Hirsch, who is a professor in the Division of Pediatric Infectious Diseases and epidemiologist at U of U Health and Intermountain Primary Children's Hospital. We have Dr. Jeremy Kendrick, who is an assistant professor of psychiatry at the Huntsman Mental Health Institute. And joining us just here in 1 second, he's walking in the door right now, is Dr. Richard Orlandi, our Associate Chief Medical Officer of Ambulatory Health at U of U Health. We appreciate everyone joining us today. We've heard a lot recently about masks now with the start of school. We wanted to sort through what's true, what isn't, and hopefully clarify some myths about masks, particularly around children. So Dr. Hirsch, I'm going to start with you with a couple opening comments. You're on mute. You're on mute. Sorry. Still on mute. Sorry. I think you unclicked it and then clicked it again. There we go.
Sorry about that. Thanks everyone for attending today and appreciate the opportunity to talk with you. I just wanted to start by sharing what we have learned in our experience in Utah about the effectiveness of masking in elementary schools, and also how well that aligns with what's been shown throughout the country. We conducted a study about COVID transmission in elementary schools in the Granite School District this past winter as part of a collaboration with the Utah HERO Project and the Centers for Disease Control and Prevention. From this work, we learned several important facts, 5 in fact, that I want to share. First, across 20 diverse elementary schools, the vast majority of students were able to wear masks in school without problems day in and day out. Second, by performing very detailed contact tracing, we learned that in the setting of very high mask use, due to a state requirement at the time, in-school transmission of SARS-CoV-2 was very low, a rate that was less than 1%. This is far below transmission rates that are observed in congregate settings when masks are not used, which can range from 10% to 50%. Third, we learned that in the small number of circumstances where in-school transmission did occur, it could almost always be linked to a problem with mask use, which just reiterates how important regular mask use is in school environments. Fourth, when we tracked over 100 close contacts of infected, contagious students in school who previously would have been asked to quarantine under our original state policies, if they were wearing masks during the time of contact, none became infected, despite having this in-school exposure. And finally, fifth, we learned that for the very small number of cases where transmission did originate and occur in school, unfortunately, 60% of those school-acquired cases led to transmission back home to their family members. So in summary, masks can be used successfully by children in elementary school environments. They are highly effective in preventing transmission. When breakdowns in mask use do occur, there's a substantial risk of transmission. And these same findings have been shown repeatedly in schools throughout the US and underscore the need for us all to advocate for policies promoting universal school masking, particularly in elementary school settings. Thanks.
Thanks so much, Dr. Hirsch. Dr. Kendrick, a few thoughts from you.
Yeah, I really appreciate the opportunity to join the conversation. I don't think it's a surprise to anybody on the call here that we're in an unprecedented time of burden on the mental health of children, adults everywhere. And for our kids in particular, there's a unique burden being faced with a lot of uncertainty and inconsistencies with, am I in school, am I out of school? And I think it's very easy for us to start to try and make ties between various things on what is actually affecting the mental health of our kids. And I think one of the things that can be tempting is looking at masks and saying, while these can be somewhat uncomfortable and irritating at times, do these masks actually negatively impact the mental health of our kids. And so I'm happy to join the conversation because I think it's really, really important to be talking about mental health during this time, but also to make sure that we're focusing on the areas that are really going to have the most impact in supporting our kids. And so I'm happy to share some of my thoughts about the evidence that we have, which really at this point does not point us to any concern that masks affect the mental health of our children negatively.
Okay, thanks so much, Dr. Kendrick. Dr. Orlandi, I'm going to go to you right now. What can you tell us? Just give us some broad strokes here about what we're seeing in the community, what we're seeing at the hospital, and you've overseen our testing and our vaccine programs. So tell us what we know from the data that you're overseeing right now.
Thanks, Kathy. All of us know from listening to the news that we're seeing a rise in cases and averaging now a 7-day average right around 1,000 cases per day that are being diagnosed. And that's an abstract number, but what does that mean? Well, what that means is right now our ICUs in the state of Utah are just about full. I think many of us heard about the news out of Alabama this morning, that they're full and over full. We do see quite a few number of COVID cases as a regional referral center with our partners at Intermountain Medical Center and others, where we're not only seeing patients from our community, but trying to care for those that are very, very ill from throughout the Intermountain West. So what that 1,000 cases per day means to us is that we are getting to the point, or are pretty much at the point, where we're full, and we are going to have to start making difficult decisions on apportioning care for this individual or that individual. And the discussion around children in schools right now is so important, because if we have a lot of spread, as Dr. Hirsch has said, among children in schools, those children then bring that virus home to their parents and their grandparents. And while yes, that 9-year-old child may not end up in the hospital, but their grandmother, particularly if she's unvaccinated, will, or there's a high chance that she will. And we want to make sure that we are able to care for her and for all of those in our community that we need to care for. Vaccinations are continuing to go up, not as fast as we'd like them to. Testing is available, but you may find that, gosh, there's not as much testing as there used to be. Why is that? We don't have the healthcare workers to do it like we did last year. Many of our healthcare workers are not available to us anymore. They're stressed. They have children at home they need to take care of that are ill, and others. We have a significant workforce issue, and the best thing that we as individuals and as a community can do for our healthcare workers is to get vaccinated and to wear masks so that they know that we as a community support them and that we're caring for those that are caring for our community.
Thanks, Dr. Orlandi. Dr. Hirsch, I'm going to go back to you with a couple questions. So when we're talking masks and kids, one of the things we hear about, and I've seen on social media, parents who say it's unhealthy that if you wear a mask, your child is breathing carbon dioxide. Can you break that down for us? Is that true?
So when you exhale carbon dioxide molecules. But fortunately, the carbon dioxide molecules are tiny, and they're smaller than the pores in our masks. So the concerns that have been raised about carbon dioxide building up inside the mask and therefore leading to carbon dioxide retention in a child or in anyone wearing a mask are fortunately unfounded because we're able to successfully expel carbon dioxide through the masks.
Okay, and then the research on the Utah Hero Project, you guys, the folks involved in that have done extensive research, thousands of students. What does the data tell us about safe mask use for children?
So what we have observed and learned and demonstrated, and it aligns, exactly the same as has been demonstrated in multiple other states throughout the US and frankly, in multiple other countries throughout the globe, is that children are very successful at wearing masks most and all of the day, wearing well-fitting masks comfortably and participating in normal school activities. There are small number of side effects that can occur, mostly related to sweating and discomfort. Some people have acknowledged that they've had skin rashes or acne just from close contact. Those are real concerns, but concerns that can be managed with changing a mask or taking a break from a mask. So first and foremost, I think it's really important to emphasize that in an environment where mask use is promoted, modeled, and encouraged, children, succeed in wearing masks most or all of the day. It's important to take into consideration things like comfort and fit. Students need to be provided choices in their masks. They need to find a mask that's comfortable and fits well. That's first and foremost.
And along those lines, is there a particular type of mask that's best for kids?
So the best mask for kids is one that they're comfortable wearing for a long period of time throughout the whole school day. There are differences in the quality of mask, yes, but the most important thing is being able to wear it successfully and comfortably all day long. And when everyone in an environment is doing the same thing, even if it's not the highest quality mask, everyone's protecting one another. All other things being equal, we want to look for masks that have multiple layers. Cloth masks that have multiple layers tend to be very comfortable because of the material. So multiple layers is better than a single layer. There are other masks that we've heard about, and recently we've had efforts for the distribution of some of the highest quality masks, the KN95 masks. All other things being equal, if that's a well-fitting mask and it's comfortable for a child to wear for the whole school day, then that's a terrific choice. But I really want to give the message that the emphasis should be on finding masks that children think, they like the look of, they like the appearance of, that it's comfortable and fits well, meaning that there's not big holes on the side of the face, allowing air to come in and out too easily. So that to me needs to be the message: is compliance. Find something that a kid will wear comfortably for the whole day.
Okay, and I do want to encourage media, if you have questions, to please include them in the chat. And Alex, I'm going to go to you in a second for Facebook questions. And one more question for you, though, Dr. Hirsch, before I go to Dr. Kendrick. What about lunchtime, recess time? Is it okay for kids to take off their mask during these times?
Yeah, it has to. Obviously, eating requires removing masks. It is true that lunchtime is one of our higher risk times because of the necessity to remove masks. It's also necessary that students be provided the opportunity to nourish themselves and feed themselves and hydrate themselves during the day. So we've got to deal with it. We do our best, and every school environment's a little bit different. We do our best to space. We do our best to promote and encourage outdoor eating when that's possible and feasible. We do our best to try to encourage students to maybe try to limit yelling and shouting and singing while eating. All those things add up. We do our best to try to eat in as well ventilated of a space as is possible. But we have to acknowledge that that's a time point when masks will be off and there's a greater risk of transmission. What really needs to be emphasized, however, is what we observed last year. Last year, every school day, students in the schools ate lunch. We found a way to do it. And the transmission rates in schools, the real world experience where students were wearing masks when they weren't eating, not wearing masks when they were eating, the real world experience was that transmission rates were extremely low. When we were able to, in the context of our studies, as well as other studies in other parts of the country, when we were able to do the deep dive epidemiologic contact tracing studies, we did find that lunchtime is a riskier time, not surprisingly, than regular classroom time. When we found transmissions, we were able to, in some cases, link it back to lunchroom exposure or close contact in the lunchroom specifically. So we have to acknowledge that that is a risk point, but we also have to recognize that students need to eat. and we do our best. And collectively, we have demonstrated over and over again throughout the US that we can operate schools more or less normally and have very low transmission rates, and transmission rates that are nothing like the transmission rates that are observed in, for instance, households or any other congregate setting where masks are not normally worn, where they could be 10, 20, 30, 50 times higher. And that's not surprising because masks won't be on.
Okay. All right, thank you. Dr. Kendrick, I want to turn to you for a few minutes. We've heard a few things, social media, in the news, concerns from parents that that masks are creating anxiety in kids, that wearing masks have created depression and social isolation. Can you speak to that?
Yeah, I mean, I think your question is, you have to start with the breakdown that it is a fact that our kids are more anxious and more depressed right now. We know that. That is something that we can't deny. And when I talk to parents, they want to do everything possible to reduce that anxiety, that stress. And so when they see or hear that something that they make the choice to do, like send their child to school in a mask, might be negatively impacting their mental health, I can totally understand how that would be a very real concern. And so I think that's where it's important to weigh less on opinion and more on kind of data, that we have. And from every bit of information we have gathered so far, there's no evidence that a child wearing a mask increases their risk for depression or anxiety. To the contrary, if you look at some population studies where they study communities where masks are used broadly, it actually decreases anxiety in those populations. We actually see individuals feeling less anxious, because when we look and see what kids are actually feeling worried about, they're worried about getting sick. They're worried about their grandmother getting sick. They're worried about germs, the types of words that we use to talk about this with children. And so when they see a concerted effort around them for people to be doing something that they're told will help decrease that, it does decrease their anxiety. And so I think the message really should be, we should be focusing on those things that really are impacting our kids. School closures are very, very difficult on kids. So we should be doing everything possible to keep our schools open, keep our kids in school. And again, based on the information we have from experts like Dr. Hirsch, I think the more kids we have masked, the more chances we have to keep those schools open. And I think that's what really, potentially has a real impact in decreasing the stress, the anxiety, the burden that we're seeing in a lot of kids across the state and across the country.
Okay, and I think you just touched on this, but we have a question here that says, there's no perceivable mental health issues for mask wearing. However, is there less a chance for stigma, less of a chance for there to be a mental health impact if masks are worn across the board?
Yeah, this is a good question. And while, I wish we had a great study that could compare a classroom that had mixed use versus, universal use. Those studies haven't been done. But as a child psychiatrist, I can tell you, kids don't want to feel different. They don't want things that bring that idea that they are doing something they are or are not supposed to do. And so one of my concerns about an environment where you have some kids doing one thing and other kids doing another thing is it does introduce, the possibility for kids to feel anxious about that decision and about that choice. And so I do think that one of the potential benefits of having more and more kids wearing masks is it just puts them on a level playing field. They don't need one more thing to really feel anxious or different about amidst this environment that's just so anxiety laden.
Okay, thank you. Dr. Orlandi, I'm going to turn to you. We have a couple questions about masking suppressing the immune system and concerns that, currently we're not exposing, I guess, both ourselves and our children to germs. We've always heard, let your kids get sick and that's how they build immunity. So is there a concern that all this over sanitizing, hand washing, masking will suppress our immune systems? And then a follow-up question to that, do we know if the virus can exit the mask?
Those are great questions. I sure hope that masking and hand washing doesn't suppress the immune system, because I'm a surgeon. And those of us who work in the operating room are wearing masks and washing our hands all day long. All kidding aside, there is some evidence, some theory that exposure to germs at a younger age can be beneficial to our immune systems in the future. And that's reasonable. That's a reasonable concern. In everything we do, we have to weigh the risks and benefits. I don't think wearing masks for a few months or however long we need to is going to have a significant impact on a child or an adult's immune system in a negative way. But the downsides of not wearing those masks that Dr. Hirsch has outlined sure outweigh the small potential theoretical change that could occur in an immune system. The same thing goes for carbon dioxide. Think about surgeons that are and nurses and anesthesiologists in the operating room that are wearing masks all day long. Somehow our brains are still functioning and we're not retaining carbon dioxide. So again, I think we have to hear these things and go, wait, does that make sense? Does that really pass the sniff test? Now, can a coronavirus particle leave a mask? Can it get through a pore? Yes. Let's think of this like Swiss cheese. Not all those pores line up. And so can I drop a peanut through a block of Swiss cheese? Yes, but the holes all have to line up for that to happen. So while it's theoretically possible, look at the evidence of mask wearing and how in our health system, when we started universal masking a long time ago, our incidence of COVID among our employees just dropped off precipitously. And the same thing we see in backing up Dr. Hirsch's data. So can a particle make it through a mask? Yes, scientifically it's possible. But the evidence for mask wearing is so overwhelming that from a practical standpoint, it doesn't make a difference. Nothing is going to be 100% in any of this. Nothing is going to be no risk particle, no coronavirus. What we're trying to do is substantially reduce those risks for ourselves and our community and for others. Can you get COVID after a vaccine? Yes. It's rare, and it's very rare for someone to have a very poor outcome, a death or significant hospitalization, but it happens. But for the vast majority, it does not. We're never going to eliminate risk. We're just trying to significantly reduce it.
Okay, thanks, Dr. Orlandi. Dr. Hirsch, I'm going to turn to you. A really good question here. This person is saying their student's district is not requiring masks. And this parent says they're not particularly worried about their middle schooler because that child is vaccinated, but an elementary school child is not vaccinated. And this parent is wondering about the futility of wearing if one child wears a mask, does it even make a difference? Is it even worth it for that student to wear a mask?
That's an excellent question, and it's an area of some uncertainty. If you want to refer to it as mask discordance, the kind of evidence that we've all been referring to about the effectiveness of masks in reducing transmission really is derived from experiences with very high rates of masking collectively. And so the idea or the level of risk that comes to someone who is masked, who is exposed to someone who's unmasked, or the other way around, if an infected person is masked, the risk to an unmasked person. That's information that we don't really have great estimates for, but it makes overwhelming sense to me that having a mask on reduces that risk, whatever it is. Building a little bit up on what Dr. Orlandi was referring to, it's not one virus particle that it's necessary to cause an infection. There's a certain inoculum size. So you need a certain amount of the virus to successfully start an infection in somebody such that the virus can begin replicating to cause a new infection. And so the less virus that you get exposed to, the less likely it is that infection will take place. So it makes a lot of sense that by wearing a mask, you as an individual who may not be immunized would reduce your chances of getting infected if you come into contact with a contagious individual. That risk would be even lower if both individuals had masks on. And that is why we feel very strongly that the best way to protect the health and safety of children, particularly those that are unimmunized in elementary schools, is to have as many people in a classroom as possible wearing masks.
Okay, thanks, Dr. Hirsch. Dr. Kendrick, a question for you. How can you say that there's evidence that kids aren't being affected when we have zero evidence of what this looks like long term?
It's a great question, and I guess, you know, and if I said we have direct evidence, I guess I should say we have no evidence showing us a link. We absolutely have no evidence showing us that the wearing of a mask increases these rates. Is there some unknown possibility here that we're unaware of? Again, from a scientific standpoint, I can't say that. And that's what we have to say, though, is what do we know? We know that kids are resilient. We know that kids got through our school year last year wearing masks, and we have not seen a significant rise in admissions to our psychiatric units with depression or anxiety where masks were cited as an impacting factor. And so what we're really left with is what do we have evidence of? And I think that evidence is clearly in the medical realm of what these masks can do to protect us from the infection. And we do know that there are very real consequences, both short-term and long-term, from having COVID, both from a physical standpoint and an emotional standpoint.
Thanks, Dr. Kendrick. Dr. Orlandi, I'm going to ask you this next question, and I think Dr. Hirsch may want to follow up since he's a pediatrician, but when do we think kids, and I'm asking you because you're over our vaccine program, when do we think kids might be able to be vaccinated, kids under the age of 12? And don't we think that will have a significant impact on stopping the spread of COVID-19?
I'm definitely going to defer to Dr. Hirsch on that question, but I'll just briefly say that the evidence for the effectiveness of vaccines is overwhelming. We can see that infection rates and the rates of death in the vaccinated, the risks of hospitalization, and also the risk of passing that on to someone else. The vaccinations are making a huge difference. So I can certainly understand the desire to get that vaccine emergency use authorization from the FDA approved for children under the age of 12. And I certainly look forward to that as well, because I think it will make a big difference in our community as it has in older age groups. And with that, I'll defer to the expert on what that timing might look like.
Yeah, there remains some uncertainty, but what I can say with some confidence is it's not going to be early in the fall unless something dramatic changes. Our best sense from playing out the whole process, the completion of the clinical trials, the length of time that the clinical trials are required to proceed, 6 months, followed by the approval process at the FDA. The best estimates are late fall, early winter. So towards the end of 2021, early part of 2022. That's our best understanding right now. Things could change. It would require some policy changes for emergency use authorization to be granted sooner than that. So we'll have to wait and see. But right now, if you're a parent of a child or a caregiver of a child or a grandparent or a friend of a child who's less than 12 years old, your expectation should be, in my opinion, late fall, early winter. I will also just add to what Dr. Orlandi said, that we do have reason to feel very encouraged about, hey, the sooner the better on these vaccines. What we're observing, so number one, in our age-eligible pediatric patients, ages 12 to 17, vaccination rates have been steadily increasing, and especially over the last couple of weeks as we approach back to school, those vaccination rates are still too low. We really need to continue to motivate our adolescents to get vaccinated. We're at about 40% statewide. However, it's really important to note that the rate of rise among cases in adolescents, for really one of the first times in the whole pandemic, is slower than the rate of rise is right now in younger children, those that are age ineligible for vaccination. And that is, while we'd like to see the vaccination rate higher than the roughly 40% that it is, our best explanation for why the rate of rise seems to be higher in our younger children is because of the partial vaccination in the population of adolescents. And that's good news as we look forward to how we can help protect the health of our youngest children.
Okay, and a quick question for you again, Dr. Hirsch. This person is saying it sounds like they might have a teenager and a younger child who can't yet be vaccinated, and they're saying, how do we protect these younger kids when the teens aren't wearing masks at school? What do you say to that? And you know what, and I guess answer that two ways. One, assuming the teenager is vaccinated, and one assuming the teenager is not.
So if the teenager is not vaccinated, the answer is we strongly encourage vaccination for the teenager. Teenagers who are unvaccinated, who are attending in school in person in environments where mask use is low, and especially if they themselves as an unvaccinated individual are not masking, are at very high risk of becoming infected. And I would say that, you know, you should assume if you're unvaccinated, you're attending school in person this year and you're not wearing a mask, you should assume that you're going to become infected. And so if the goal is to protect other member, that individual, that teenager, and the rest of their family, some of whom may be unvaccinated, then the first and best step is to vaccinate that teenager. And second, I'd recommend that you know, an adolescent, even if vaccinated, who's attending school in person, who has concerns about household members at home, be it because of their age or because of other chronic underlying medical conditions, I would encourage that teenager to wear a mask in school, even if not everyone else is. Now, there are social challenges, as we discussed earlier, as Dr. Kendrick discussed quite nicely. Unfortunately, there is the potential for stigma when you're, you know, not doing what most others are doing, and that needs to be weighed. That risk needs to be weighed, and you know, that frankly is all the more reason to encourage vaccination among teenagers to lower that risk should they be unmasked in a school environment. Okay.
And this is a good question, Dr. Kendrick, for you. How much of a child's stress and fear and anxiety is coming from parents who are not handling those issues that well during the pandemic?
Well, I think we as parents are nothing if not opinionated, right? I mean, we want to care for our kids. We want to do the best. And I think every parent out there has a very strong desire to do right by their kids. And so they read a lot. They try to get information from any source they can. And I think that leads to situations where parents are very passionate about what's right for their kids. And I respect and admire that. I do think that does lend itself when these kids get together and hear about these different opinions and different types of information and different viewpoints. It can be, again, one more thing that sets up differences. And that can be a source of stress. Now, I think most kids are absolutely comforted by their parents. And so I would never want to get in the way of making sure that a child feels comfortable talking to their parents. And so what I always recommend is that parents just have open dialogues, answer questions that their kids have. I think that communication piece is absolutely important. You know, if their child comes home from school having heard something one way or the other, to help them understand where that information is coming from, what it might mean, what the implications are, and comfort them in the way that they know best as parents to do so. But yeah, there's a lot of tension out there, you know, not just for our kids, you know, for us as adults as well. And so I think the more that we can, I think, focus on doing the things that will support each other and build each other up, the better off we'll all be.
Okay, and Dr. Kendrick, I think we don't have that many questions left, so I'm going to give you a final question here and then a final thought. Is there any truth? We've heard that suicides have been on the increase directly related to masks and anxiety about masks. Is there any evidence suggesting that?
I'm not aware of any evidence that makes that link. Suicide is one of the biggest issues facing our youth, and it's something we take at the utmost seriousness as mental health providers. And believe me, if that link were anywhere close to tangible, we would be very, very well aware of it and discussing it. I'll just say as an answer to that, every single one of our children and adolescent patients who are on our psychiatric units who are struggling with depression and suicidal ideation, every single one of them is wearing a mask right now because it's what we have to do to keep them healthy. So I appreciate the question, and I interpret that as just concern to keep our kids well. But the answer to that question is no, I'm unaware of any actual link.
Okay, and I'm going to go around and ask all three of you, but I'll start with you, Dr. Kendrick. Just final thoughts from you as we, embark on a new school year. All these things we're hearing about kids and their anxiety and pressures, peer pressure about wearing a mask or not wearing a mask. What is your best advice for parents? Talk to your kids.
Have open conversations with them. I think as parents, look at where you are gathering the information that you're gathering to help you make the decisions that you're making as parents, and make the best decision for your child. That's the situation we're in right now. And I think the more that we focus on making sure our kids feel safe and reassured, the better off they're going to be. I think parents are probably the most important factor in that whole discussion. And so I think any parent that is able to have open conversations with their kids, hear what they're bringing home from school as far as any stress or anxieties, and being able to communicate openly with them about those stresses and anxieties and respond appropriately, it's the best we can all do as parents.
Okay, thanks, Dr. Kendrick. Dr. Orlandi, I'm going to go to you next. What are you seeing on the horizon here in terms of our community, our hospital, what we're seeing with the Delta variant? And what is your message for our community?
With the Delta variant, what we're seeing now is things are probably going to get worse before they get better. And I wish I didn't have to say that. With schools opening and with the lower level of masking that we're seeing, we can probably assume that the next month or two are going to be harder than the last month or so. And that's going to make it difficult for our entire community. One of the things that I love about our community is that we care about others as much as we care about ourselves. And in times of stress, it's normal to look inward. But this is a time that each of us as individuals and as a community can look outward and think about the children down the street, or that are in our the other children in our child's classroom, in our church congregation, in our community group, down in our neighborhood down the street. Let's be thinking about their needs. Let's be thinking about our healthcare workers' needs that are caring for others. Let's do what we can to support one another. Let's take a deep breath when we hear a piece of information that doesn't quite sound right, that maybe is playing upon a fear. And let's ask ourselves, is that really true? And let's get some solid information about whether that's true before it guides a decision, before it increases the stress for us and therefore for our children. We can get through this together. We can do it again, as long as we continue to care for one another.
Thanks, Dr. Orlandi. And I'm glad you have that message about caring and thinking about each other. I think a lot about not only the long-term effects of COVID, but the long-term effects of what our children are seeing in terms of how adults are behaving. So I think that's always such a great message. Dr. Hirsch, I'm going to give you the last word. Tell us your advice for parents who have concerns going into the school year.
Well, on the one hand, I think it's really important to validate those concerns. We are seeing a burden of disease among children that is unprecedented throughout the whole of the pandemic. The share of infections that is being shouldered right now by children is at a level that we have not seen to date. And by that, I mean the percentage of new cases each day is now in the range of 1 in 5 cases are among children. That's equal to or exceeds nationally the share of the overall population that are children. Early on in the pandemic, children represented small percentage of overall cases, and that's increased throughout the last several months and greatly accelerated throughout this summer. And we're seeing the effects of that in our pediatric hospitals. More and more children than ever are being hospitalized with severe infections, life-threatening infections in many cases. So it's really important for people to recognize that the Delta variant, both because of how easily it's passed among children, because of how much more open we are living now, how much more contact people are having on a day-to-day basis with others, and now with school opening, how much more contact there is going to be, that children are more than ever in the pandemic, susceptible to getting infected, and they can get very sick with this. At the same time, we have many tools to limit the effects of COVID on children. Those include masking, in all indoor environments, in big groups, including schools, promoting masking as much as we possibly can, and encouraging all of us to get vaccinated. And I guess my last message would be to those who have concerns about vaccination, whether it's for themselves, a family member, a friend, reach out to someone in the healthcare setting or someone you know who's been infected, and make sure your questions and concerns are heard and your questions are answered. Because what we've seen is that a lot of people have questions and concerns about vaccines, many of which are important and valid, but they don't always have the opportunity to get those questions answered. And we want to make sure that those questions can be answered so that we can get this incredibly effective vaccine to as many people as possible.
Okay, Dr. Kendrick, Dr. Hirsch, and Dr. Orlandi, thank you all very much for being here with us today.